Good afternoon, everyone. My name is Rudy Page, and welcome to Vaccine Confidence Dialogues online. So this is the first in a series of sessions that will be taking place. And our role on this particular platform will be to ensure that you are informed, reassured, and you make your choice. And over the coming weeks, it will be very much about the communities, and the workforce. So we're particularly aimed at the African and Caribbean population groups to ensure that they get all the information they need as it relates to the vaccine and the basic questions that are being asked. This forum will be covering those. So I'm pleased this afternoon just to introduce some of our members across the community to just give you an outline of their experience in terms of the vaccine. I've had the jab, I'll say that, and I'm very pleased to first hand over to Ola, just to say a few words. Thank you, Ola.
Sorry about that. Hello, my name's Ola Agbamoni. I've proverbial moot. That's going to be the new watchword, isn't it? You're on moot. So yeah, and I work for NHS England and Improvements, and we've commissioned Rudy to do these conversations because we're very keen to listen to what the community are saying and to improve vaccination confidence amongst the community. So these conversations about your concerns, to highlight what you want to ask us, to myth bust, and to see how we can encourage more people to get the vaccination. I've got my vaccination booked for Friday. And I'm really looking forward to it. My mum's been vaccinated, my mother-in-law's been vaccinated. I come from a family of medics, so they're all vaccinated. I really think that it's something that, as a community, it's a good thing. So we don't win unless we all win. So hopefully that people can find the information they need to make an informed choice and decision for themselves, and then go out and spread the word. That's all I had to say at this point. I'm going to be leaving in 3 minutes because I got lots of meetings to attend today and they overlap. So sorry about that. I would have loved to stay to hear your conversation, but I'm sure I will pick up at some other point.
Absolutely. Thank you very much for that, Ola. And good afternoon to our, what I call our trusted messengers. And as Ola said, that there will be some, throughout these sessions, there will be some key questions that we will be asking on behalf of our community. And when we talk about our communities, that's the community, the workforce, because we say the workforce is our community as well. So the key questions are around: what information do you require to reassure you that the vaccine is safe? So what information do you require to reassure you that the vaccine is safe? What information do you require about the vaccine? What information do you require about the vaccine? And then finally, what is your understanding on how the virus is spread among families, at work, and across local communities? So what is your understanding on how the virus is spread among families, at work, and across local communities? So over the next few weeks, we will be having senior clinicians from all different backgrounds, and particularly from African and Caribbean population groups with the expertise and the requisite qualifications to speak on these subject matters in order that we can have the dialogue and, as I said, provide the information, the reassurance, and so that the community can make their choice. And when we say community, we mean the workforce as well as our families as well, which is really important. So I'm going to, looking at such an array of speakers here, I think I'm going to start with Dr. Beverly Lindsay, then I'll go to Dr. Dwayne, then I'll go to Orrin Lewis, then Tony Kelly. So Beverly, please tell us your experience as it relates to the
Of course, you
the
say,
vaccine
Dr.
journey.
Thank you, Rudy. Good afternoon, everyone. People might think I'm not a medical doctor. My experience with the vaccine, of course, I've had the vaccine.
Mm.
And, you know, and I have a background in nursing. So therefore, I'm never afraid, you know, of taking medication. And you have to follow the science. You know, however, so many people in our community, you know, are afraid, you know, for one reason or the other.
Yeah.
They listen to, you know, negative, you know, messages on WhatsApp. My mother, who is 96, you know, she spends all day on the WhatsApp listening to all these messages and reading. And so she refused to take her vaccine. So when I had mine, I called her and I said, well, are you going to, you know, we tried to persuade her. She said, no, she's not having it. However, after I've had mine, I called her the first day and I said, well, I've had mine and I'm okay. And she said, well, it's only the first day, you know, so I have to wait and see. But anyway, about 3 days later, I called her. She called me to find out how I was doing. I said, I'm fine. So she's since taken hers.
Excellent.
You know, and I have to remind people that when, you know, we were children back home, you know, I came here in the 60s, we, you know, we used to queue up to take our vaccine. You know, I said, look at the scars on our left shoulders, you know, it's all there. We didn't question anything. I'm old enough to remember when polio, a lot of kids in my schools had polio, and I remember some of them died and some of them have to start having one leg longer than the other, have to have calipers on. And so we were rushing, you know, to take that sugar lump, you know, so it's no different. I tell my friends, I say, you know, when you're ill, you go to the doctor, they prescribe something to you, you're taking it, you don't even know what you're taking. You take paracetamol every day for headache, you know, if you have cancer, whatever disease, you're going and you don't know what you're taking, you're not questioning it. And, you know, they say, well, they just come up with the vaccine. I said, scientists have been working for years, you know, researching these things. And it's just another flu job, you know, with another name. So I try to encourage, and I can tell you, a lot of my friends have since, you know, because when they start, you know, relating it to back home and the scars and your vaccine from measles, mumps, rubella, whatever, you know, they start realizing, you know, I had a friend who called me, intelligent enough person, and said, well, I heard something that you're going to do something about changing your sexuality or and all this kind of foolishness. Yeah, you know? So yes, you know, I encourage people. I made a video through the lieutenancy on my other hat that I wear, and you know, we sent out viral, and you know, I'm happy to say that I've changed a few people's minds.
Right.
Thank you very much. I'm Beverly Lindsay. I'm from Birmingham. You know, I run a travel agency too, and we are suffering. So, you know, I have a vested interest also in the vaccine. I chair the Association of Jamaican Nationals in Birmingham. Excellent. And I'm a deputy lieutenant. I'm a former Vice Lord Lieutenant of the West Midlands, and I'm now still a deputy lieutenant. So I reach a wide range of people in the community. And thank you very much.
Thank you very much for that, Beverly, and that's so helpful. Dwayne, over to you, sir. It's your unmute. You unmute yourself, Dwayne.
Okay, brilliant. Is that clear?
Yeah, loud and clear.
Fantastic. Once again, Rudy, thank you for inviting me to join this group of folks in the community to talk about building confidence around the vaccine. And hi to Beverly, who's spoken just before me, because Beverly will be one of the many people involved in Reach Society's Virtual Careers Conference between the 6th and the 9th of April. But in terms of my own personal experience of the vaccine, at the top of the ticket, my wife and I took it on the 8th of March, and we had no hesitation about it because we know a lot of people who've died from the virus and a number of people who are living with long COVID. So they're disabled in any number of ways. Either their brains aren't functioning as they used to, or their kidneys are now malfunctioning, or their livers are playing up, or their hearts are racing out of control. So one of the things I know from those casual contacts You do not want to have the virus and survive it and having to live with long COVID. But most of my friends, and I'm talking about a lot of professional people across the country, not just in London, who are of my sort of age, you know, they're in their early mid 60s, have taken the vaccine, and for good reason, because they are a bit like what Beverly has said. They've got a history of taking vaccines from they were children, and they see this in exactly the same way. There's a nasty virus on the loose, and if this will help you to be protected, they will take it. But, you know, in all of the people that we know, there is a handful that is hesitant, and it's very difficult to understand what is driving the fear. And if I had to put my finger on it, it's mostly because they don't have enough knowledge about what's going on, what's behind the vaccine, how it's being developed, and so forth. And the unfortunate side for many of them, they are not looking to trusted sources to get the answers they need. And so the fear is being stoked by disinformation from various places. The other thing, if I keep it close to home, is I've spoken to my 4 grown children, and they're of an age where they're likely to be in the last group or the penultimate group getting the vaccine. But they're quite clear that they will take it for this reason. They have friends and their family members, and they have lost family members who've contracted the virus and have died. So from that sort of ongoing wider experience, they're quite clear they will be taking the vaccine as well. But, you know, to end on a point which, Rudy, you're aware of, I'm the chairman of Reach Society, and we've been concerned now from the start of the year about the whole issue of vaccine hesitancy. So what Reach Society has been doing is holding a number of conversations where people can get the facts. The last one we had a doctor who was heavily involved in the whole vaccination process who answered many, many questions. We also had a toxicologist who is a chap who is very close to the whole vaccine process and also how it was being tested. And his answers were as clear as you like. The vaccines were developed with all ethnicities involved. It's been extensively tested on animals. It would not be offered to human beings until we had enough toxicology data to say that 2 things. 1, it would be efficacious, and 2, it would work. So, you know, there is a lot of good information out there, and folks just need to tune in to the right sources in order to keep themselves properly informed. Hopefully, this will be one of those sources as the weeks go by.
Thank you very much for that, Dwayne. And of course, we've got the event with Reach Society on the 16th of April to come. So thanks for that. Orin.
Thank you, Rudy. Good afternoon, everyone. I'm Orin Lewis, the co-founder and chief exec of the African Caribbean Leukemia Trust, the ACLT. We raise awareness about the urgent need for more people, especially those from the Black mixed race communities, to register as stem cell, also known as bone marrow, blood and organ donation. And the subject matter of the vaccine and hesitancy and confidence and dialogue is very much familiar with us, because it's a similar theme that we've heard for the last 25 years in terms of people from our background registering as donors because of the direct link between the patient and the donor being from the same ethnicity. Now, about talking about the vaccine, personally, myself and my wife Beverly, we've lost loved ones to COVID. My uncle's wife passed away weeks after being released from Norfolk Park Hospital into a care home, and that was the end, because obviously the care homes, that's where the vaccine was rampant, and we know of other people. And so, the virus, yes, sorry. Thank you for that correction. So for us, it's personal, and we're talking right now in real time to a lot of close family members who are, many are for taking the vaccine, but it's quite a few who are totally against the vaccine, and very much symbolic of the debate that's out there in the community.
Yes.
So it is coming down to personal choices. My wife Beverly's had her first jab. She's got her second jab in May. I'm finally going to get mine on Friday afternoon and have my second one in May. And it's a case of wanting to be part of the solution rather than being part of potentially a bigger problem by people isolating themselves by not taking the vaccine. Wearing my professional hat from the ACLT, we've very much been creating a platform and a debate for people to come forward, like Dr. Neil said, with his organization, allowing people to have a conversation and discussion through webinars about the subject matter. We had one a couple of weeks ago where we had something like over 900 people coming on to ask series of questions and get those questions answered by a panel of physicians, healthcare workers, heavily involved in the vaccine, in the development of the vaccine, doing presentations about what the vaccine is all about. And I'm glad to say the feedback we've got from that has been very positive in terms of people who were actively on the panel, including Andrew Cole, the ex-footballer who's a kidney transplant recipient, was very much not sure when we started that webinar, but by the time we left 2 hours later, I got to say, I'm going to think about this a lot more now that I've got the research is in front of me. And he was symbolic of many people. Even up to about an hour ago, I was speaking to someone online who said, I've seen your webinar and it's convinced me that I need to go and get the vaccination. So us coming together here today and the future events you have, Rudy, I think it's vital. It creates the opportunity for people to get the research and to make an informed decision. That's all we're trying to do, is get people to make an informed decision based on the facts rather than the fake news and the myths and the fears that are rampant out there in our community. So it's really for us to come together, meet in our minds, to try and save ourselves as well as the rest of the community, because the rest of the community needs us on board.
Yes, actually, before you just finish, Oren, I know with the work that you've done in sickle cell, and it has been raised with people with blood disorders and the vaccine, what have you kind of said to members of the community with those kind of fears?
It's a good question. We had, for example, we had some sickle cell patients on that, and organ and stem cell patients on that webinar, and we've spoken to before and after. And there's quite a strong hesitancy, not sure whether they should take the vaccine or not. But one of the big bonuses that came out of that webinar was literally all of them said, now we have the facts. Yeah. Verified facts, even down to going into the clinical trials situation around it and everything. They now feel confident of taking the vaccine. And we had, our event was on a Thursday, and on the following Monday, a stem cell patient, blood cancer patient, who wasn't sure, went and had a vaccine on that following Monday, got a sister and others to do the same. So the patients, Rudy, they are coming around and actually understanding that the people that we're putting them in touch with, physicians, hematologists, are saying, yes, it's good to do research, but you will be, it's from the information that we all know about the vaccines, it is safe to take it, but be aware that there might be some side effects, which is commonplace to all of us in some shape or form. But at the moment, it's safe to take.
Great, thanks for that, very helpful. Tony?
Hi, Rudy, thanks for inviting me. I'm Tony Kelly from Birmingham, and I am one of the diabetes ambassadors, stroke champion, stroke advocates here in the Birmingham area. This June coming, I've been doing this health and well-being in terms of diabetes. This June is 9 years. So this isn't just a starting thing for me. I've been out there in communities doing on average 150 community events per year since I started, since I retired early in my equality diversity role that I had as a middle manager. I have type 2 diabetes, so that's my starting point. It runs in my family. I've had it for 18 years. And every year without fail, I have the winter flu jab. So lots of NHS clinical commissioning groups come to our home in Birmingham or see me at sites and video me over the years and say, hey, as a Black man who can talk for Britain, you need to go out there and get the message that people must take the flu jab. So that has always been my, what I've been doing. So with the vaccine, myself and my wife, we both had the first dose of the AstraZeneca. Our next dose is due sometime in April, I think. I'm actually going to Panelcroft. Panelcroft is well known in Birmingham. This is a multi-purpose residential home with people living independently and some living in residential settings. And 90% of the people at Panelcroft are African Caribbean, and they're hesitant to take the vaccine. So they've asked me, I've been down there 3 times over the years to do diabetes events. So it's somebody that they can relate to. It's pro-social modeling. They're saying, hey, let's get Tony to come and in groups of 15, spread out social distancing, tell them about what I've been doing, taking the winter flu, taking this vaccine and so on. They'd rather listen to the likes of me than I've seen ads on the television, wait for it, where they have 3 white males.
It's the trusted messengers, and
Exactly.
that's why we're here.
Yes, I've seen them have people like David Beckham, Michael Caine, and Elton John. You're going to an African Caribbean or Muslim or Asian or Sikh or Hindu community and show them Beckham and Michael Caine is who we saw last year, Dinosaur and Elton John. Are they going to listen to them? It's people like us on this webinar who then need to say, this guy, this woman, this man, what have you, they can relate to us. We're the same skin color. We come from the Caribbean or we come from Africa and so on, which is why I go all over the world and do these talks. And people say, although you don't, they say, are you really British? Because I'm British born, but grew up in Jamaica. But simply put, it's African people, Black people relating to one another. And that's what I'm about. Some people can't stand me, but that is their problem. I am here to help those who want to be helped. And as I say, I'm going to Panelcroft tomorrow to try and convince the doubters and the hesitant people that are there. And there are lots there, I've been told by the manager, who want to hear from the likes of me. And that's why I'm pleased to be part of this. And I'm available to the diabetes events from the comfort of our home here in Birmingham, anywhere, anytime. People in Nigeria call on me, Florida call on me, Ghana call on me, and people back here in Birmingham or Britain on the whole. Never saying want it, can't get it, and get it, I want it. I'm here, I'm available, and it's free. I'll stop there.
Thanks for that. And that's why I called on you as well. Right. Okay. I must welcome us on my colleague from NHS England. If you want to say anything, you can always just unmute yourself and say a few words. If not, let me go to Jennifer McIntosh, then Bev, and then Jackie.
Yeah, good afternoon all again. Thanks again, Rudy, for inviting me to this meeting. It's very interesting, and I'm probably going to be saying the opposite of what most people have said so far. And you know, that's coming from
in your personal experience.
No, that as well.
Because today's very much about the individual personal experience.
Yeah. Okay. Yeah. Well, my personal experience is I have lost a couple of family members to what they term COVID. That's debatable. I haven't had the vaccination. I'm not sure if I trust the messengers, and that's including the professionals. Okay, that's including like you said earlier, Tony, VIPs, celebrities, and also.
But excuse me, though, Jennifer. What I would say though, on this particular forum, which I think I did explain before, it's about us being informed, reassured, and then making the choice. And the trusted messengers on this forum, series of sessions, are from our own communities of African and Caribbean people with the expertise and background. So I have to kind of stop you there, because that's what this forum is about. That's what it's designed for. There are other forums where there is a level of skepticism. We understand that, That's why we've produced this forum that provides that for the community to be informed, reassured, and make the choice. And that's why at the very beginning of this, I said there's some key questions that will be answered by ourselves in terms of our experts. What information do you require to reassure you that the vaccine is safe? What information do you require about the vaccine? What in your understanding, what is your understanding on how the virus is spread among families, at work, and across local communities? So that's what this particular forum covers. So that's the scope of what we mean by vaccine confidence dialogue.
I suppose I was coming from the angle of my association.
I need to be reassured that you accept what
I do accept. Like I said, I know that I'm the odd one out in this sense, in terms of my opinions. So I do accept. Again, I mean, like I said, my name is Jennifer. I'm the chair of the Unison Black Workers Group. That consists of over 100 members. I'm also the International Relations Officer for Unison, which, you know, we've got a committee of 50 people. And I'm also the founder of the UGMA Partnership Organization. So I'm very much informed, okay? And I do get a lot of people asking my opinions, and that's why I'm interested to be on this forum, because I can be the messenger in terms of going back with some of the discussions.
Okay, but if I go back to, I must assist you in terms of this particular meeting. So, which I did say prior, that this particular meeting is about those within our community who've had the vaccine, which we call the trusted messengers. And what we're starting with is just to relay the personal experience, because we know there are questions to be asked and answered, because it's about vaccine confidence dialogues. And through that, people will be informed, reassured, and then they make the choice. And that's what this, so I'm going to have to stop you there, because that's what this is, what this particular forum is. We know there are other forums for raising those questions, which is fine, but this particular forum is very clear on the aims and objectives. So I'm going to have to move to Beverly Bogle on that now.
Hello, good afternoon, everyone. My name is Beverly Bogle, retired general senior nurse. As the other Beverly, I too have got knowledge of limited of the medical field and knowledge of infection control and knowledge of all the different way we manage infections and viruses. I too, yes, I've had my vaccine, and members of my family has had their vaccines, especially those with underlying problems such as being on dialysis, lupus, kidney failure. Yes, they've all had their, and I was quite anxious, especially my sister, to ensure that she gets it. Yeah. So far, I had my vaccine in February. It's 6-7 weeks now. Yeah, and the only thing I had was as you're told when you have this vaccine is flu-like symptoms, which was, you know, you're accustomed to getting chills and sneezes or whatever. And so far, I've been good. My partner's had it is great. Everybody that I know, I've got retired celebrity friends. They've gone out and they've had their vaccine, all the family, mothers, grandmothers. In my surrounding, I have very few people that have got negative thinking and thoughts about the vaccine. and I've managed to coerce quite a few of them for going out and having their vaccines. And they'll call me, they'll say, Bev, I've had my vaccine. No one knows. The government has already said that it's not a prevention, but it's to secure your antibodies, your immune system, to help to build that up. This is why we need a second dose. However, no one has said that it's going to be the end of that once you've had the vaccine. Maybe we'll have to have it yearly as we do the flu jab. And as Beverly say hi to, I've got the scars from my what we call BCG here and stuff back on Polar. This, and I remember too queuing up as a kid, getting the little drop and the lump of sugar, you know, and all these things. My kids, they've had, I gave all of them their vaccines as babies, 4 of them, and all of them went through it, even with the German measles. They've had it in school, all these things. So it's, if you've got allergies and you're susceptible to what you may call opaques that they use in x-rays and iodine, and it's for your duty when being questioned and asked to say, this is what I'm allergic to, this is what I'm having now, whether it's be antibiotics, diabetic stuff, whatever. It's up to the individual to answer the questions honestly, because I've worked in the area where I've done medical assessment, I've done all sorts of assessment as a nurse, and I know that especially the elderly people, when you ask questions to them, they'll not answer you honestly. You've got to find another way. If you're determined that they have to know what you're talking about, you've got to find another way to ask them the question when they least expect it. And you'll find they say, oh, yes, yeah, and this is my way. But so far, I'm still working on people, especially the men, the older men in their 70s, that you know, I just don't entertain them, because my partner's got a couple of them that are like that. Oh, there's nothing such a thing. I said, let them stay, yeah, but whenever they get it, right, if they don't want to protect themselves by washing of the hands, wearing the face mask, sanitizing, we've got to follow these rules because it does help. Clean the house, then spray. I'm terrible, right? I'm always sanitizing the door handles, the bathroom.
Yeah.
My children, they come here, they stay at the door. If they're shopping for me, they drop it in the porch area. I do go out, but I don't go out to places that I know I shouldn't go.
Yeah.
And I'm being very careful. All it needs is care. No one knows. Even yesterday, the government is warning that there might be another spike in June, July. And you might think, why is that when we're getting the vaccine? People must never forget that the vaccine is not a prevention, it's a protection.
Yeah.
And this is what you need to educate people about.
And Bev, you really underline the point of point 3, the third question that says, what is your understanding on how the virus is spread among families, at work, and across local communities? And it's something that does need to be understood.
Yes, and that's where we finding it difficult for people. I mean, yesterday I was sent a video, this is from back home, with someone that has money at Elsha Beach, how he was behaving, and it was appalling. If we had something like that here, that would just knock out what we're trying to educate people with.
But you saw that there was a follow-up one with him being arrested, standing in the police station.
Yes, there was. Yes,
right.
There was.
Okay. Yes. Look, can we go to Jackie?
We need to reinforce that here in this country. People need to be punished if they're not taking it serious. I don't care who you are, because you're leaving me exposed to what you've had to reinfect if you don't do what you're supposed to.
And that's why we must inform. Yeah. We must ensure everyone's informed.
Yes.
So, Jackie, thank you for waiting a bit of time.
Okay. You can see me? Can you hear me?
Yes, we can see you. We can see and hear you.
Okay, great. Right, so, as you mentioned, my name is Jackie Green. I live in South Essex, Sussex, to represent the health and social care communities, the BME communities. I had my vaccination on the 27th of February. That was the first one. And yeah, well coordinated. I had to go to Eastbourne to have that. And yeah, I'd like to be able to encourage people from the Black and ethnic minorities that is well established, well coordinated services put together. I also, due to my business that I represent for home care workers in Sussex, that's providing a home care business that's able to provide a service for vulnerable adults in the communities, and so being able to have the vaccine and to protect people that you're working with on the front line basis is very important for Black and ethnic minorities. And so it's the only way forward with the global pandemic. Also, due to being a part of the faith community, there's the churches such as KICC, that's the Kingsway International Church. And they've put together a global summit or conference recently, and they put together policy specifically for the vaccine, the uptake of the vaccine, because there's been low intake of people from Black and ethnic minorities to come forward. So you got medics from around the world that came together, doctors, and all sorts of different medics coming together, and they put together a policy to address that. So there shouldn't be any reason why people from our communities, including faith communities, should not come together and do the right thing for themselves, for others. As I said, it's the only way forward, really, to be able to come out of this global pandemic in a healthy, well-structured way, and also to continue to do the things that we should do: washing hands, wearing the mask, interacting safely. Although it's a challenge when you go shopping, when you go out there in the communities, people don't want to adhere to the 2 meter different distance. I've had so many different collisions, and yeah, so you just have to take a stand professionally, and do the necessary.
Great.
And so I do feel that I am informed. I do feel reassured now I have taken the vaccine, and hopefully an inspiration to people who are considering whether to take the vaccine or not. It's the only way forward.
Thanks for that, Jackie, because you raised a number of key points in terms of social care workers at the front line. So yeah, in the sessions, there will be specific sessions for social care workers as well as NHS staff, because we know there are issues around, we've heard it, no jab, no job, section 44. So these kind of issues will be addressed. In terms of the workforce, there would be issues around professional code. There's the issues around professional expectations in terms of colleagues, and of course, in terms of the patients as well. So the whole area of workforce hesitancy is an integral part of this platform, because the workforce are our communities. Our communities are our workforce.
Yeah.
So that's one thing that we're going to ensure across the platforms, that we have an approach called separate and complementary. So we will be going through these in the absolute detail with experts around employment. Senior NHS England staff will be on these platforms over the coming weeks, as well as we've said already, experts and the trusted messengers, the transformational influencers, as we call them. You touched on the churches. So our Pentecostal churches are already engaged. Our 2 largest ones being Church of God of Prophecy and New Testament Church of God, and other churches that are engaged in the process. So it's important for people to know that our churches are involved, and over the coming months, we will see that. And in terms of, as you touched on there, in terms of the social care staff, we're also we'll be looking at the vaccinators as well as the community we want to take the vaccination. So uptake at all levels. So this is a multi-layered program designed to provide for people to be informed, reassured, and to make their choice. Right, so we're really coming down to the end of this first session. So what I'd like to just quickly do, just before we all depart, is just give you an idea of the key points that we will be covering as well. So we will be covering what you need to know about the COVID-19 vaccine. So it will be about the facts about the COVID-19 vaccine, why you should take the vaccine, vaccine safety and reassurance, understanding the transmission of the virus, benefits versus risks, and the consequences of not taking the vaccine. And through these links as well, community links, it's connecting to community radio stations like Fresh FM Radio London, Station FM. As I mentioned already, organisations like Reach Society, Association of Jamaica Nationals, the Association of Jamaica North London branch. So it's linked into other business networks as well, Kiwanis as well. And a lot of the WhatsApp groups, groupings, and Facebook groups, the information will be shared widely and very carefully to ensure that that vaccine confidence, at least we've done our part from both in the community, but also within the system. So we are looking at and being very clear in terms of the community pharmacies as well. I should mention the community pharmacies as well, because of course they're in the neighborhoods, because it is very much, the vaccine is very much about neighborhoods and local communities. So we will be in linked forums with them as well. So as you can see, the African and Caribbean population group, the experts, the trusted messengers, the transformational influencers, we are collaborating, we are doing our bit for not just ourselves, but the whole community. So on that note, I'd like to thank you all very much for attending this very first session for Vaccine Confidence Dialogues online. And as we said, we want you to be informed, reassured, and then make your choice because you've got the facts. And on that note, thank you very much and good evening. Thank you. Bye.
Thank you, Rudy.
Thank you.
Okay, thank
Thank
you.
you all. Thank you, Jennifer. Thank you,
Bye.
Beth.
Thank
Thank
you
you,
very much.
everybody.
Thank you.
Lovely to see you.
Bye.
Lovely to
Bye.
see you too, Beth.
Yes.